long, long ago, from the Central Asia, people who spoke an old version of Persian language migrated northwards and reached the Scandinavian peninsula. From there they penetrated downwards towards Europe, and those Normans who occupied England, they brought the English language with them. In old days it was called Anglo-Saxon. So the word God is born out of the old Persian, which still retained its word exactly as they were spoken earlier. Khuda is the word, and God is the distortion of the word Khuda. Khud and good. Khuda and God, they are the same words in fact, and the slight pronunciation and disorder of the one word Khuda has turned into God. Khuda also has a meaning, thing which comes of itself. There is no one who creates it. Khud-a, that sort of thing. That is the meaning I have attributed to it. But the word Khuda, I believe nobody has mentioned this significance. Maybe I'm wrong, but I love to translate it like this. So I think it is Khuda, which has been mispronounced and transferred to English language and has become God. You see, like daughter, for instance. Daughter is written D-A-U-G-H-T. It should be pronounced Dukhtar. And Dukhtar is the Persian word for daughter. And in Old English it was pronounced Dukhtar. Now we wonder why this stupid spelling. Why add A-G-U-G, sound at all when it's not pronounced? But when you trace the history of pronunciation in English, you'll be surprised to find that Arabic Persian words were pronounced like Persian words in Old English, which is called Anglo-Saxon. And later on, gradually they changed further and further as they went away from the source. So that is what I believe happened to the word Khuda.
My next question is regarding homeopathy, School of Medicine.
I know you are an adversary, but what is wrong with it? Tell me.
Yes, sir, I was an adversary in the past, but the modern trend is in the West, mainly in Europe and in Canada. I can't say about the United States. The trend is changing towards the homeopathy medicine.
Correct, you are absolutely right. So you have also reformed?
Not yet.
All right.
My few colleagues who have practiced medicine for 20 years, they have gone to the homeopathy school, Royal College of Homeopathy in London. They did 6 months advanced course. And they are going to practice in my area, the homeopathy. What I'm saying is that I know that you have been practicing homeopathy for a long time. You must have a large number of cases. But my question was, is there a specific treatment in homeopathy towards the stress or stress-oriented symptoms or symptoms?
You see, there is no specific treatment as such. But there are so many medicines which are related to the stress and the stress-related syndrome. And one has to go by the symptoms. Because according to homeopathy, it is not just a disease after which we prescribe. It is a symptom complex after which we prescribe. A headache, for instance, to an allopathic doctor is headache, and aspirin would be the first word which comes to one's mind, or any other similar drug. And the approach is to dull the senses so that the pain may remain there, the cause of pain may remain, but the patient feels at ease despite the presence of the pain. Homeopathy does not treat pain as such. Homeopathy goes for the cure of the source of trouble. If the source of trouble is removed, then the pain will disappear. So that is why this headache becomes a headache for a homeopath, because he has to find out why this headache. And if he analyzes correctly, then the medicine which he gives works like magic. It does not remove only the sense of pain, but also removes the reason for that pain. Similarly, for every nervous disease, for every depression, there has to be some particular specific cause. So you can't treat the nervous depression in generalities. You have to analyze the symptoms of the patient and find out what possibly could be the cause. If you correctly analyze, then you prescribe him something. With the grace of Allah, then it works miraculously. If you share the symptoms of the patients you have in mind, inshallah, I'll prescribe something for that. But also, I tell you that sometimes in certain situations of stresses, like social stresses all over and general stresses, many a time one drug also works in so many patients. So it is possible for you to analyze the case of one patient, find a successful drug, and in similar situations start using it without much attention to detail. And in 50, 60, 70%, it is possible that that would work. So I can prescribe it, not here, later on when you send me the symptoms in detail, then I'll tell you what you should use. Thank you.
Would you advise Ahmadi physicians to explore more into the homeopathy?
Very much so. I deeply encourage. I direct them, I instruct them, I help them in diagnosis, and some of the Ahmadi doctors in England are very happy to report to me that many such patients which were not cured by them through allopathy, they were cured allopathically. And the patients in England not only come from Ahmadis but from all over the society. British, people from other groups, foreigners of all sorts. And sometimes some interesting things happen. Once I received a letter while I was traveling on the tour of America last time. I also came to Canada. I received a letter in America from a British specialist from Harley Street. And he said that there was a patient of mine whom I considered incurable. When she next time visited me, she was absolutely all right. When I inquired from her what had happened, she gave me your address and said, you practice homeopathy and you treat such patients, so would you permit me to refer to you other such patients? You see? So the evidence came not from my wishful thinking, but from somebody who had no knowledge of homeopathy, but who was an expert in his own field. So things are working, and homeopathy is becoming very popular in England nowadays. Extremely popular. And it's a matter of time when it will take over the allopathy, but not surgery. Mind you, it's a completely different and independent branch. Surgery is not a rival of homeopathy. Allopathic medicine is a rival of homeopathy. And as such, I advise Ahmadi doctors to learn homeopathy if they can and enlarge the scope of their serving the cause of humanity. Thank you.
Thank you, sir.
Yes, please. After the bare-headed gentleman, I will turn to the blue cap. Okay? No, it's all right. It's not necessary to ask a question, they can. Muhammad Salim Zahid.